My name is Angela Gordon. I'm a physical therapist, and I've been working as a therapist for 13 years. I work in Washington, D.C., so I am in the Northern Virginia region, which is outside of D.C. I have had 13 years of experience working in outpatient, and I'm also an athletic trainer, so I work with a lot of athletes. My passion coming out of school was actually female athletes, and as a female athlete myself, I was a collegiate athlete and suffered many injuries, so I had a very big passion about injury prevention and female athlete triad. But I was fortunate enough to work with an orthopedic surgeon that became the orthopedic surgeon for one of our professional baseball teams in the area, and got asked to work baseball. And I didn't know anything about baseball when I started, but I learned, and it's been 10 years, and now I've developed a new passion for the overhead athlete, which is where we have developed this new course, the overhead athlete, to target physical therapists and to bring a different light into the world of treating overhead athletes. So any therapist that is interested in becoming or treating overhead athletes, or any therapist that currently sees overhead athletes, I think would be appropriate to treat it. We have put together some content information that was initially based off of my training from NAIOMT and the other experiences that I have gained working in the professional setting, which is unlike no other setting to be in, and it really gains a lot of experience and insight into professional athletes, which is a completely different world than treating high school or Little League athletes. So we've put together some advanced concepts and special considerations to look at, and just treatment techniques that I have developed over the years that have been very successful, because I don't have 8 visits to make a player better. I have 10 minutes to get a player back on the field. So you have to be quick and you have to be effective. So we've put a lot of that stuff together into a 2-day course, and it's going to cover shoulder, elbow, but also the kinetic chain of the athlete, because we all know, those of us that treat professional athletes, it's not just a shoulder and elbow that you're treating, you're actually treating the whole kinetic chain. So NAIOMT gives you a really great basis to learning the shoulder biomechanics and the upper quadrant biomechanics and rehab techniques, but when you treat an overhead athlete, there's special biomechanics and different anatomy that happens. An overhead athlete gains the range of motion that they need to throw over a course of a lifetime, and there's special anatomical pathologies and considerations that happen for that athlete that you can't just apply to a patient that's 42 and has shoulder impingement. It's way different than treating an overhead athlete. So there are different techniques and feels to the techniques that we look at, and different things that we specialize in and deal with. Like we are very huge on the scapula, and there's a huge section of this course that's going to be just devoted to the dynamic scapula, that I call it, because it really is so dynamic, and you have to understand that that is your force regulator for the whole throwing motion coming from the lower extremity, and understanding how that force transfers through the scapula into the throwing arm is huge. And then you really need to know how you've got the dysfunctional scapula, so how do you treat it? And so there's a lot that goes into putting all those pieces together, because it's not just a scapula. You've got to look at the cervical spine, you've got to look at the thoracic spine, you've got to look at the glenohumeral joint as well. So there's a lot of moving pieces that we put together in a sequential order that helps somebody put everything into a streamlined fashion to be able to go back to the clinic and be like, okay, I can actually evaluate this in a systematic way that can give me the best bang for my buck and actually target the areas that need targeted the most.